Our heart is a powerhouse beating 100,000 times a day without us even noticing. But when your heart rate suddenly changes, you feel it. Dr. Caudle knows this firsthand, and it concerned her enough to search out for answers. Take a look.
I'm a doctor, but this is one situation where I should have taken my advice a lot sooner. So in the last month, I started noticing that my heart was racing when I was doing activities, walking, things like that. But I blew it off. I thought it was anxiety. Well, one day, I actually decided to check what my heart rate was. My pulse was over 100. And that was the first time I started thinking, maybe there's something going on with my heart. And I went back through the logs of my smartwatch to see what my pulse had been over the last number of months, only to find out that it had been high many times and I hadn't even known it. So I started talking about what was going on during my Facebook Lives. We are at the cardiologist's office because I am getting a stress test done. My heart rate has been going too high. It may not be my heart, but I'm a little worried about it. So here I go. I did the stress test on Monday. The next thing that I was scheduled to do was to have a Holter monitor, which that's what this is. It's reading and recording all of my heartbeats, and it's sending it to some place in the whatever that's reading it. Honestly, I was nervous for a number of reasons. Is it an arrhythmia where it's an abnormal rhythm? Would I need to take medication for it? What does this mean for me down the line and long term? It was just a lot of unknowns. That and the fact that I'm always a doctor, but this was one of the few times that I was a patient, and it can be scary.
Well, Dr. Jen, we're sorry to hear that you've been having these problems,
Thank you.
But you're feeling okay, right?
Well, I'm feeling okay right now.
Well, good. Maybe it's here being on the doctor's set. It's
yes.
Soothing and therapeutic. I'm glad to hear that.
Yes.
But that being said, we're going to bring your cardiologist right into the discussion. So please welcome Dr. Daniel Tarditi. Welcome to the show, Doc.
Thank you so much for having me here. I appreciate it.
Hi, Dr. Tarditi. It's good to see you.
You too, Dr. Caudle. You as well.
All right, Dr. Tarditi, let's put this in perspective. So are Dr. Jen's heart issues common among both middle-aged men and women?
Absolutely. It's very common. It's one of the most common reasons people go see their primary care physician or cardiologist is because we all feel extra beats here or there, a skip beat. But when you start to feel this more frequently, et cetera, that's when you get more concerned. And part of it's understanding what you're feeling. When you feel an extra beat, it's usually a premature beat. So normally the heart's contracting. You get an early beat, which doesn't fill as much. So the next one fills more vigorously. And you'll feel that little skip beat, almost like a record player skipping or aeroplaning on your car. And that can be normal if you feel it once in a while. But when it's persistent and you have other symptoms, that's when you need to seek out medical attention, like Dr. Caudle.
When does it become a concern? I think you touched on that briefly, but at what point do you go, wait, I got to look into this further?
Well, definitely if there's other symptoms associated with this. If you start getting short of breath, you start getting dizzy, or heaven forbid you passed out, you're getting chest discomfort, those are red flags that should really make you seek medical attention, even if it's not that often. If you're not having those symptoms, then you can sort of do a little digging yourself. Track to see, when is this occurring? Or has something changed in my life? Did I start a new job? Am I, struggling with finances? Am I having other issues that could be exacerbating this? Have I gone from a cup of coffee to 8 cups of coffee a day? Those are the questions that a person like myself or Dr. Caudle, if you see her in the office, are going to ask you about those background issues, because that's what really sets the stage to frame what symptoms you might be occurring and might be experiencing.